Hello, my name is Rick Lautenbach. I am a clinical psychologist, and I lead therapy groups on all of the adult inpatient units here at the Institute of Living. I know I've met many of you, but for some of you, this may be my first time meeting you, so hello. So welcome to this brief presentation, which is entitled Improving Patients' Treatment Through CBT Goal Setting in Startup Group. What I'm hoping to accomplish through this presentation is to do a number of things. I'm hoping, first of all, to empower you to become more aware of the important impact you have on all patients' therapy, regardless of what your job role is. This is a milieu. We all have an impact on the milieu, and everyone impacts all patients' treatment every day by our interactions. I'd like to also describe a few important concepts of cognitive behavioral therapy, also called CBT, and describe a few important concepts regarding therapy that's offered in a group format. I'd also like to describe how patients' treatment can be improved through CBT goal setting during startup. Well, what we talk about regarding setting goals in startup is also something that can be done in one-to-one meetings with patients as well. So either way. So first of all, I want to emphasize again that regardless of who you are a provider of therapy. People sometimes wonder, well, what experiences that a patient has in the hospital are the actual therapy or the important therapy for the patient. Medications or physical safety, medical care, discharge planning, meetings with clinicians, meetings with psychiatrists, meetings with other patients. I would tell you that all of the above are positive experiences. All positive experiences people have with each other and with staff are part of the important therapy that we do here. We provide milieu therapy, and the hope with milieu therapy is that people, by their experiences interacting with each other, will experience a positive effect. So you are an important component of this therapy every day that you're at work. So a few basics of cognitive behavioral therapy, or also called CBT. So what is cognitive behavioral therapy? Well, CBT is a philosophy of mental health treatment on which a number of mental health interventions are based. So there's an awful lot of different types of therapy that are based on CBT. A foundational concept on which CBT is based is the idea that thoughts or cognitions, feelings or emotions and bodily sensations, and physical actions or behavior all have an impact on each other and can alter each other. And this is sometimes referred to as the CBT triangle. And I'm going to share my screen for a second and show you that. So this would be one example of the CBT triangle. Keep in mind that thoughts is another word for cognitions. Behaviors are physical actions, things that we can do that we can physically see. And feelings, which really include emotions and our bodily sensations. All those are considered aspects of feelings. And that's the CBT triangle. And this is aiming at indicating how affecting any one will affect the other at the same time. Okay. So another foundational concept of CBT is the practice of evaluating the effectiveness of interventions. And so CBT is really based on trying to get some kind of evaluation. And we're aiming to be as objective as possible when we're evaluating whether an intervention is effective or not. And the usefulness of an intervention is generally evaluated based on the amount of change that can be documented. So I say as as measurable as possible. I know that many things in mental health, it's hard to measure, but attempting to use units of measure that are something we can easily detect or tell if it happens. So if the person had a goal of talking in group 2 times, at the end of the group, it's pretty clear if that happened or not. Or the person may say, I want to walk up and down the hall for 10 minutes a day. That would be a concrete thing. If I want to say, I want to increase self-esteem, that's harder to measure. We could say, I want to practice self-statements to myself that are positive at least 5 times during the day in order to increase self-esteem. Okay, that would be something we can measure. Did I remind myself or talk to myself 5 times a day, telling myself positive things about myself with the hope of increasing self-esteem? So that would be an example of how we would attempt to make something measurable. So there's a lot more to CBT than that, but for our purposes in goal setting, we're going to really kind of just mainly focus on the notion of cognitions, behaviors, and feelings affecting each other, and setting objective, measurable goals. A couple basics about group therapy. So group therapy is a staff-led way to deliver mental health treatment in which patients are provided with opportunities to have positive therapeutic experiences within a group format. So that means that this is some kind of an intervention that is offered with at least 3 people present. That could include the therapist and 2 other people. It could be more than that, but minimally there's 3 people together. And the idea is that when people are in groups, they behave differently than they do when alone or even on one-to-one. In part, in one-to-one interactions, it's easy for one person to disavow something that the other person believes happened by just saying it's your word against mine. When there's 3 people in a room, it's harder to disavow your behavior. And so people tend to be more thoughtful and give more thought to how they're coming across. So behavior does tend to differ in groups as opposed to individually or one-on-one or with 2 people in a room. Also, any experience that enables the patient to improve their health and well-being as a result of interacting with others in group is a positive therapeutic experience. So many different kinds of things can take place in group, but the hope is through interactions, people will be able to change their behavior. They'll experience something that they find helpful in their behavior change. Just as there's a lot more to CBT than what I mentioned earlier, there's an awful lot more to group therapy, but that's the most basic I can make it. So what would one do at the beginning of any therapy group? Anytime you're in a group attempting to be the facilitator and create a positive therapeutic experience. So whether it be startup or any group at all, I would always recommend the following. First, you want to promote therapeutic rapport. Don't assume that you have therapeutic rapport. Even if you know the people in front of you, you don't necessarily know them in the group. So they may act one way with you one-on-one, but they may act differently in front of other people. So I would say always start a group by introducing yourself and any co-leaders. I would also ask patients to introduce themselves. Even when they say they all know each other, just kind of all get this is part of forming rapport that exists right now in this particular group. So even if 2 people know each other, when they hear each other speak, even saying their names, it begins to give people information about how is this person today? Are they a person that I can talk to like I did yesterday? Or am I detecting that they're a different frame of mind, even when saying what their name is, that makes me feel more cautious and careful. So this is in part to create rapport, not just between you and those in the group, but among those in the group as well. I would also recommend at this point, this could be very brief, but saying something, a few sentences aimed at encouraging patients to experience you today as kind, respectful, and motivated to be helpful. So regardless of how people may have experienced you before, you want people to experience you today as being open and helpful to them, and that you're benevolent, that you're no one to be afraid of or concerned about, worried about. Don't assume people experience you as that just because you're a mental health provider. Many come into the hospital thinking that we're just the oppressors, we're the authority figures who oppress them. So say some things which you think will help people experience you as benevolent. And say a few words aimed at helping people in the group to feel more comfortable with each other. It could be commenting on something that's going on in the room, commenting on the weather, commenting on something that happened last night, something that helps people to feel a sense of comfort with each other in the room. I think that this first part, this promoting therapeutic rapport, not enough attention is paid to it, because without this step, things may be more likely to go haywire later in the group. Next, orienting group members to the therapeutic activity. I would always actually say what the name and the time frame of the group activity is. I would also let everyone know what the guidelines or rules of the group are. Also, I would take a few sentences to describe what the leaders and patients are being asked to do in the group, and say a few words about why it's believed that this may be beneficial. Finally, instruct the patients about how they can go about doing what they're being asked to do, and give some concrete examples of what doing this would look like. Don't assume people know this. Some may, some will not know, and some may have known but forgotten. So here will be an example. Let's say that you're starting the startup group. You want to state the name and time frame of the group. So I would say, good morning, everybody. This is startup group. This group takes place every morning, except for the mornings when community meeting is scheduled. And we're going to go from now till 9 o'clock. That's the aimed end time of the group is 9 o'clock today. Next, you'd want to, again, inform patients regarding the group guidelines or rules. So I would say something like, as with any group activity, it's expected that everyone will be respectful towards each other. Please allow one person to talk at a time. Don't talk over others. Do the best you can to listen to whoever's talking. Try to be aware of not talking for so much time that others will be unable to have time to talk. And I apologize in advance, but I may need to interrupt at times to keep the group on track and to help us to finish on time. If there are other guidelines you think are important to mention at this point, this would be the time to do it right now at the beginning of a group. So then moving on to the goal setting part of startup. There may be a lot that goes on in startup before this, but the goal setting part, as I mentioned, you want to say a few sentences describing what the leaders and the patients are being asked to do in the group. So I might say, I'll be asking each of you to tell us about a small goal that you would be willing to focus on today that may help you with your health and well-being. As the group leader, my role will be to, and I'm going to name a bunch of things, you might do one or more of these things. It might be to write the goal on the whiteboard in front of the room, or it might be to give you a paper and pencil so you can write your goal down yourself. Or I may say to let other staff members know about your goal so they can remind you and support you to accomplish it. It could be all of those, but let them know what your role is going to be in this to help them with this. As I mentioned, you want to say a few sentences about why it's believed that this is beneficial. I mean, many people are going to be like, why bother doing this? This is stupid. What for? So I would say something like, well, why am I asking you to do this? Well, from my experience, patients who've been in the hospital in the past who told us that their hospital stay was helpful typically have said that setting small goals, underlying the word small, and working on them each day was an important part why their health and well-being improved. So not just my word, but other patients have very often said this. People have also added that having a small goal to focus on each day reduced their anxiety and gave them a sense of hope. And finally, people have oftentimes said that focusing on a goal increase their sense of having some control in their life. So if they believe that certain things, certain goals that they were accomplishing were helping them to improve their health and help them to get out of the hospital, that helped them to feel a sense of, they don't feel as much control as they would wish, but this may increase their sense of having some impact or control over their length of stay. So next, instructing patients about how they can go about doing this. So I would say something like, by small goal, I mean something that is small enough so that it is likely that by the end of the day, you'll be able to achieve it. So nothing bigger than that, something that is doable, you think, in the course of one day. When setting a goal for yourself, keep in mind that thoughts and feelings and behaviors all have an effect on each other and can cause changes in each other. At this point, I would actually show a picture of the CBT triangle to people and help them to get a sense that, to see how these are all connected, that one affects the other. And anything you change in that triangle is going to have an impact on the other parts of that triangle. I would add that many have found it most helpful to set a specific behavior as a goal, hoping that by engaging in that behavior, it'll have a positive effect on their thoughts, emotions, or bodily sensations. And so one can make a goal about thoughts, emotions, or behaviors, but typically the one that people are most successful at is making behavioral goals and connecting those behavioral goals with their impact on thoughts and feelings. Finally, instructing more about instructing patients about how to go about doing this. Tell them a goal is most likely to be helpful to you if it is a behavior that is specific enough so that at the end of the day, you'll be able to determine if you actually succeeded in accomplishing it. It's perfectly okay to make bigger or longer term goals, but we are mainly interested in everyone setting a small daily goal here. So if you want to add longer goals, that's fine. If you want to set a small goal that is part of working on a long-term goal, that's absolutely fine. But we do really want you to set a short-term, small goal that you think you can accomplish today. It's also okay to set more than one goal, but I would say it's better to set one goal and feel good about accomplishing it than setting several goals and possibly not feeling so good about not accomplishing all of them. There's no problem in accomplishing more than a goal that you set, but people tend to undermine their self-esteem if they set many goals and only accomplish some of them. So giving some concrete examples of doing what is being asked. So examples of behavioral goals. Spending 15 minutes practicing mindful breathing, or calling 211 today regarding getting a shelter bed, or going to at least 2 of the therapy groups on my schedule today, or talk to my treatment team about my stress at home. Another would be to spend at least 20 minutes in the day room to improve my social connections with others, or write my journal for at least 15 minutes today. So they go on, but this will help hopefully give people some examples of what we mean by concrete, small goals. Now, there are a lot of barriers to patients setting goals. I've seen lots of startup meetings, and I oftentimes have heard people saying things like, my goal is to get through the day, or my goal is to be discharged, or my goal is to get my doctor to give me more of a certain medication. I've seen all of that, and those are perfectly understandable. In fact, it's likely that many people are going to have those kind of goals, and they may say, I'm not setting more goals than that. That's it. That's my only goal. I wouldn't press them too much on that, but why would they do that? Are they just acting out, or what? Why are they being that way? Well, a lot of times people just don't feel a sense of hope. And so if they don't feel a sense of hope, why make goals at all? So if you think someone's not setting a goal because they just don't have any hope at all, maybe there's some things you can say at that moment that'll help them feel a sense of it's not all hopeless, that there might be some useful reason for setting a goal. People sometimes feel so emotionally upset about being in the hospital that they cannot focus on any concrete steps for getting out. So with that, I would do anything we can to try to help people feel less emotionally upset about the notion of being in the hospital, to validate that that must feel really, really awful. No question about it. And I don't know how to help people to feel less upset, but also you may want to add, after you've validated that it's understandable to feel upset, that you might want to set a goal anyway, even though it's really upsetting to you to be in the hospital. If they say no, then they say no. Oftentimes people say that they feel a sense of injustice that they're in the hospital, that this is all just bogus, that there's really no reason for them to be here. They don't need to be here. It's invalid. And they sometimes feel like if I cooperate by setting goals, then I'm in some way acknowledging the validity of my hospitalization. I don't want to do that. And so somehow acknowledging, I get it. Your sense is that you do not belong in the hospital at all. I get it. No question. I hear you. I wonder still, the reality is here you are in the hospital. And so given that that's the case, would you be willing to set some goal for yourself, something concrete that you'd like to do that you think will be good for you before the end of the day? People sometimes feel embarrassed not knowing how to set a concrete, specific goal. And so that's where, if you know the person, it will be okay even to suggest some goals. I wouldn't like suggest goals that you think the person is just going to say, yeah, okay, that's right, it's fine. And they're just going to tell you what you want to hear. But, gee, John, I know you've been very, very upset, very, very down. Is there anything that you think you'd like to attempt to do today because you think it might just nudge your mood into a good direction? So, some specific thing that might make you feel improved today. So that would be a way of trying to help people, to guide them in case they're just too embarrassed because they're not certain, how do I do this? What do I do? I don't want to look dumb in front of everybody else. So helping them to have a better idea about how to do that for themselves. And sometimes people feel like they don't have any influence on how their life goes anyway. Well, life just goes. There's nothing you can do about it. I mean, you got to react. That's it. And I would say, acknowledging, yes, you're right. There's an awful lot in life that we may not be able to have control over. However, I wonder if there might be some small pieces that potentially you might have control over, or might be able to get control over. Is there something you'd be thinking about doing today that you think you have the power to do this? And you don't have to rely on chance for whether or not you can do it. So those are some ideas to think about if you find people being resistant to setting goals, to see if one of these barriers might be part of what's getting in the way. Again, as I say, if people just absolutely refuse to, there's not much. I wouldn't make it into a fight, but just continue to be encouraging. So let's say that you want to start a therapeutic group. How would you do that? The first thing is to come to the monthly group therapy consultation meeting that takes place, that I lead. We're doing it by Zoom. Soon we hope to get back to doing it live, but each month there is a meeting regarding talking about therapy groups, including how are groups going that are running, as well as who might like to start a new group and help with that. Trying to figure out what patients might need. Ask patients, what do you think is missing? Or ask staff, what do you think is missing from the group program that we have? If you do decide on something, you want to define the objective. Exactly what is it you're trying to accomplish in this group? And then figuring out, once I know what I want to accomplish, what are some of the things that I might be able to do in the group or ask patients to do that could help in succeeding in accomplishing what we hope will be accomplished. Once you've discussed this with the group therapy consultation folks, then will be to create some educational content and come to the meeting each month and talk about how it goes. So I hope that this has been helpful, and I hope this helps you in helping patients in the startup meeting to set concrete CBT goals for themselves. And you can also do this in one-to-one meetings. If you have any questions, my name is Rick Lautenbach. Please feel free to reach out and ask me. All right, take care.